Good day, class. For our next lecture, this is your all about decalcification. So, decalcification basically is the second step, no, of your histopathologic techniques of start with fixation, then dehydration, decalcification. Then you have your dehydration, clearing, impregnation, embedding, trimming, sectioning, staining, mounting, and then lastly is your labeling. No, so let's start with your decalcification. So before we discuss about the process of decalcification, so let us review first some anatomy. So basically your bones, now this is a long bone, no? Has two components, your compact bone and your spongy bone. So basically your compact bone is made up of osteons. They are the ones that are tough, strong, heavy, and they are the outer layer. As compared to your spongy bones, they are made of trabeculae. They're the inner ones, and they're the lighter ones. No, so basically, ang sulod, inner ones are your spongy bone, and then it is surrounded by your compact bone. So basically, you have here your medullary cavity, which is the hollow space filled with your marrow. No, so mostly if yellow, na it's mostly of fat. And we have three parts: your epiphysis, your diaphysis, and between them is your metaphysis, or where you can see your metaphyseal plane, which is responsible for the growth of your bone. So your distal part is your epiphysis. Then you have your diaphysis, the long part, and between them is the metaphysis. So the composition of your bone: one third organic, two thirds inorganic. So organic are the cells, the collagen, the fibers, and the matrix. Inorganic are the mineral salts, no, mainly your calcium or your calcium phosphate, which makes your bone hard. So you have three bone cells. You have your osteoblasts, osteocytes, and osteoclasts. Osteoblasts, of course, the bone-forming cells. Osteocytes are the mature cells, and osteoclasts are responsible for the bone resorption. So, of course, it is just important to wear your PPE or the proper personal protective equipment in processing bones because they are also infectious. No? So, complete PPE lang dapat yapon. So, when you say decalcification, this is the process whereby the calcium or the lime salts are removed. No? So, this is done after fixation and, of course, before impregnation, which will facilitate the normal cutting and prevent obscuring the microanatomical detail. So, bones and calcified tissues, especially those that have suffer from pulmonary tuberculosis or those that have atherosclerotic diseases, they are cut into small pieces to permit complete penetration of your decalcifying agents. So these are um, the decalcified, no, decalcified tissues. You have your bones, teeth, peritomas, the PTBs, the atherosclerotic vessels. So these are usual materials used, no, to cut your decalcified agents, no, before decalcifying it or before even fixing them. So steps before your decalcification. So fixation, of course, is step one. Bone should be cut first before fixation. However, if there is a soft tissue or tumor attached to the bone, there should be an initial fixation, and after which, after cutting the tissue, you should fix it again. No, so usual is your 10% neutral buffered formalin. Also use zinc formalin mixtures, or BFAL, your formal acetic alcohol, on your bowens. So usually these fixatives are used to preserve your bone marrow. So what are your decalcifying agents? You have your acids, chelating agents, ion exchange resins, and your electrophoresis. So for your acid, you have many: nitric, formic, your trichloroacetic, your hydrochloric acid, sulfurous, chromic, citric, and your von Ebner's. So let's start with your nitric acid. So this is the most common and the fastest decalcifying agent. This is a strong inorganic acid, and its rate for decalcification is 1 to 3 days. However, it causes spontaneous yellow discoloration because of your nitrous acid. So this is lessened by adding 5% sodium sulfate or 0.1% urea. So also prevented by adding formalin or alcohol. Okay. So it also impairs your nuclear stain and it destroys tissue antigens for immunohistochemical staining. We have here your types of nitric acid solution. You have your 5 to 10% or the aqueous nitric acid, which has a 12 to 24 hours decalcification time. Also, formal nitric acid solution, which imparts yellow color, that has a 1 to 3 days decalcification time, and also have your Perennis fluid, which decalcifies and softens altogether, 2 to 7 days decalcification time. So the complete decalcification should be measured by your radiographically, and it causes tissue maceration. So basically, um, this softens and breaks down your tissues. No, however, this is avoided no by adding chromic acid and alcohol. Another is your fluoroglucine nitric acid, which is considered to be the most rapid decalcifying agent, and you also have your decastrous fluid used for silver impregnation of your nerves. Another decalcifying agent is your formic acid. This is a moderately acting agent which produces better nuclear staining with less tissue distortion and safer to handle than nitric acid and hydrochloric acid. So this is gentler to tissues, a weak organic acid that has a decalcification time of 2 to 7 days, and it is recommended for your post-mortem research. You have two types, 10% aqueous formic acid with 1 to 7 days decalcification time, and then formic acid sodium citrate, also for your post-mortem materials, for bone marrow, and has a decalcification time of 3 to 14 days. Another decalcification agent is your chelating agents. These agents combined with your calcium ions and other salts to form weakly dissociated complexes enable to remove calcium from tissues. Now, so the main component of your chelating agents are your EDTA. So basically, EDTA, you will madungog ninyo usab ang EDTA ay naghihima naman day mo. So, you're familiar with EDTA. So EDTA basically binds with your calcium and it forms a non-soluble, non-ionized complex. It does not bind to calcium if the pH is below 3 and faster unbinding if the pH is between 7 to 7.4. So the calcification rate of circulating agents is 4 to 8 weeks, 1 to 3 weeks for small specimens, and then 6 to 8 weeks to totally decalcify the dense cortical bone. So in that span of time, the solution must be changed every 3 days until mag-daily na unchanging to completely decalcify your specimens. Also have your creating agents, you have your Versine and your Cal-X. Another agent is your ion exchange resin. Um, this is your ammonium, no? Ammonium form of your polystyrene resin. So basically, this hastens your decalcification by removing the calcium ions from formic acid containing decalcification agents. No? So therefore, increasing the solubility of the tissue. So layer of your ion exchange resin, approximately 1/2 inch, should be put at the bottom of the container. Then specimen is placed on top. And then the calcification agent is added about 20 to 30 times the tissue and allowed to stay for 1 to 14 days. So this is your IER. Then you have here your decalcifying agent. So there are specimens sa ito. And then your IER previously used may be reactivated, or the previously used IER may be reactivated by immersing them in your hydrochloric acid and wash them with distilled water twice. You have here electrical ionization. So calcium are your positive ions, which are attracted to negative electrodes and then subsequently removed to the tissue. So one here, naa diri ang negative electrodes, no? So ang ikuhaon nila ang positive because your calcium is a positive ion. So i-attract niya, no, with the negative electrodes to remove the calcium from your specimen. So time is shortened due to heat and electrolytic reaction and used for small bone fragments. Important setup, no? Dip the thread used to suspend the specimen in a melted paraffin wax and avoid metal cap containers. So you have different tests for completion of your decalcification. You have your physical or mechanical method. So this is a finger method, no? So touching, pliability, and resistance to fingernail. So you can also do prickling. However, it produces prickling or needling, basically can produce artifacts which would destroy the cellular details and would lead to misdiagnosis. So, this may also, no, ang sobra-sobra na pod nga physical or mechanical method may result to disruption of the soft tumor from the bone, so which would lead to false positive microfractures and may lead to misdiagnosis. Radiological method, so most ideal, reliable, sensitive. However, this is expensive due to its ability to detect the smallest focus of calcium. No, it would appear as an opaque to the image. However, this is not recommended for mercury chloride fixed tissues because they will tend around the tissue na already opaque na daan. Chemical test, this is a simple, reliable, and convenient method. It detects your calcium salts by precipitation of the insoluble calcium hydroxide or calcium oxalate. So the calcification agent, after 24 to 48 hours, is changed and then it will be tested. No, katong agent na gikuha ninyo, it will be tested. They would add an ammonia, and then if there would be a cloudy, no, solution, therefore incomplete pa ang calcium removal. So basically, clear solution after 30 minutes, meaning the classification is already complete. So as long as napay cloudiness, so padayon ang declassification. Solutions used, you have your ammonium hydroxide concentrated and saturated aqueous ammonium oxalate. You can also use tissue softeners, which basically are used to prevent damages in your knives, no? Knives in your microtome. So your Perennis fluid, Molliflex, which basically the tissue would appear swollen and soapy. However, it would not affect the tissue processing and staining. You also have a 2% hydrochloric acid and 1% hydrochloric acid in 70% alcohol. Post-decalcification, this is the removal of excess acid done by immersing your decalcified tissue. So you can immerse it in saturated lithium carbonate and 5 to 10% aqueous sodium bicarb. So common practice is to rinse the decalcified specimens with running tap water, approximately 30 minutes for your small specimen and then 1 to 4 hours for larger specimens. So if EVTA is used, so basically you cannot place it directly to 70% alcohol because the residual EDTA would precipitate in the alcohol and within the tissue. So you should use first, or you should rinse first your EDTA na na kung i-decalcify niyo using your EDTA, you should rinse it first with water or overnight in formal saline or phosphate buffered saline to prevent crystalline precipitates. Excuse me. So you have here several factors that may affect your decalcification rate. First is your concentration. So a higher concentration, of course, would lead to a more rapid decalcification time. However, it is more harmful to your tissues. Volume recommended is 20:1. 20 ang volume sa inyong decalcification agent is to 1 sa your tissue. Temperature, of course, increased temperature hastens the process. However, recommended is at room temperature or 18 to 30 degrees Celsius. Agitation speeds up the process, usually mga automated tissue processor. And of course, the structure of the tissue, no? So the higher the size, the higher the consistency, the longer the process. Ideal is 24 to 48 hours only. So also remember that too rapid removal of your calcium salts may lead to complete digestion of your tissue specimen or what we call the maceration. Okay, so that ends your decalcification. So as a review, your decalcification basically is a procedure for the removal of your calcium and your lime salts, which basically is um, used no, for your calcified specimens, your bones and teeth ang most common. So this is a process, no, a form of process that involves ionization because basically you remove ions, now your calciums. So recommended temperature again is 18 to 30 degrees Celsius. Ideal time required for decalcification is 24 to 48 hours. And the ideal volume of your decalcification agent is 20 times, no? So 1 is to 20 ang ratio. So, uh, what else? Decalcification agents, you have your nitric acid, which is considered to be the most common and the fastest decalcifying agent so far. So this is recommended for your routine processes, no? So however, it undergoes yellow discoloration, no? But maybe yellow discoloration owing to the formation of your nitrous acid. So recommended concentration of your nitric acid is 5 to 10%. You also have your 10% aqueous nitric acid, which has a decalcification time of 12 to 24, recommended for urgent biopsies and for needle and small biopsy specimen. Formal nitric acid imparts yellow color. However, this may be neutralized with 5% sodium sulfate and then with running water for 12 hours. Also, remember your formal nitric acid is very hazardous, hence it must be processed, no, using or inside the fume hood. You also have your Perennis fluid, no, used also for tissue softener, so it could decalcify and soften at the same time your um, calcified specimens. However, it may lead to maceration, so you may add chromic acid and alcohol, no, to prevent the digestion of your bones. You also have your hydrochloric acid, no, which is recommended for your surface decalcification. So use with 1% solution with 70% alcohol. So na-mention ganina ang von Ebner's fluid or recommended for teeth and small pieces of bone. So it is made up of 36% of your saturated aqueous sodium chloride, concentrated hydrochloric acid, and your distilled water. Formic acid na mention, moderate acting, used for post-mortem research, has two solutions or preparations, aqueic formic acid for small pieces of bones and teeth, and formic acid sodium citrate used for autopsy materials, bone marrow cartilage, and tissue studies. Calcification time of your formic acid is 2 to 7 days. You also have your sulfuric acid, which is considered to be the weakest decalcification or decalcifying agent. Another mechanism, another type of your decalcification agent or decalcifying agent are your chelating agents. So basically, they combine with your calcium ions to form weakly dissociated complexes and ultimately remove your calcium salt. So most common is your EDTA, no? So you also have the commercial ones, the Versene and the Sequester. You also have your ion exchange resin. So basically, this will hasten your decalcification. So It removes the calcium ions from the formic acid, thereby increasing the solubility of your tissues. You also have your electrophoresis or your electrical ionization. So, remove nila ang calcium through the attraction of your calcium ion, which is a positive ion to the negative electrode. No? So, the time required for the calcification is shortened because of the heat and your electrolytic activities. Okay, so um, ways now of measuring the extent of the calcification, you have your mechanical and physical course through using or bending with through bending and touching no with your fingers. So you could also use your prickling or needling. Now, however, maka-obscure siya sa inyong process, sa inyong examination. Radiological or X-ray method, this is very expensive. So this is not always convenient. It is not also recommended for tissues fixed with your mercury chloride because nana siya opacity daan. Chemical or your calcium oxalate test. So basically, this is simple and reliable. Change every 24 to 48 hours ang solution. So basically, if cloudy, napay cloudy, na if it presents with your cloudiness, therefore incomplete pa ang decalcification process. Okay? So next lecture would be your uh, DCIE na, your dehydration, your clearing, your impregnation, and your embedding. So this would be the last topic for your midterms. So uh, next meeting, um, review na ta sa ato na discuss including fixation. No, again, class histopath, gamay lang ang kailangan ninyo na understanding. So just understand the principle and more on memorization yun siya. So it would help, no, repetitions would really help. Sa una, flashcards ko para easy to recall na kay tungod sa repetitions. Okay? So, magsad lang ko over the weekend ano, para sa DCIE. Okay? Dehydration, clearing, impregnation, and embedding. So, thank you and have a good day.